I really felt like I had to do. As a nurse, I guess to try to empathize with the patient's feeling. A lot of patients from different backgrounds. You know, as a nurse, you're exposed to them, and you try to put yourself in their shoes a little bit, and I think I'm able to do that. I worked in some form of nursing for 30 years. I started out as a nurse's aide when I was working as a secretary, just to see if I would like the program or like being a nurse. And I liked it, so I became a licensed practical nurse. And I worked in critical care for 5 years as an LPN. And then I got my associate's degree. And then through night school, I got my bachelor's degree. And through more night school, I got my master's degree and my nurse practitioner. So I finally finished school when I was 46 years old. It's a whole different focus being a nurse. I think there's more patient involvement as a nurse, and there's more, you treat the patient a little more holistically. Like a lot of doctors, especially specialists, they focus on one area of the patient. But when you're a nurse, you're focusing on mind, body, and soul. My connection with the patients, because I'm an HIV specialist, I see my patients often, and often I mean like every 3 months, because there's so much involved emotionally and physically with the patients. You get very involved with not only them, but their family, so it gives you that opportunity to treat the patient holistically. Keeps me motivated is, I would say, the advancement that medicine has made in treating HIV, that I see patients come here that are extremely ill, and if the patient takes their medications, follows up with their medical appointments, their health is restored. They're never a cure for HIV at this time, but they can control it, and I just see that drastic change and improvement in their health. Right now I work 9 to 5 because I'm a nurse practitioner, but when I worked as an RN, I was doing 12-hour shifts, like 3 12-hour shifts a week. As a nurse practitioner, it's a little different than as a registered nurse. As a registered nurse, it's like starting your shift. I always start at, like, say, the 7 a.m. to 7 p. shift. And you would go in, and the first thing you do is you put your pocket, and they tell you exactly what is going on with the patient you're going to be caring for that day, what happened in the night, and what the goals are for the day. And then after that, you go around and you do your vital signs, check for their blood pressure, their temperature, see what immediate needs they have, and then you prioritize what needs the patients have at that point, and that's how you set up your day. It's very good for new nurses when they come out of their training to work in a med-surg floor, because that's where you get to your organizational skills. Being an organized nurse is extremely important because you have so much to do, and the better organized you are, the more efficient you will be, and the better care you'll be able to give to your patients. Patients do not follow their medication regimen as they should, maybe because a lot of them just cannot get off taking recreational drugs like crack cocaine, and it makes the patients not able to follow the plan, and then I just get very frustrated to see them getting sicker and sicker when I know there are things that can be done if they would just do it, that they could have a very healthy life. And for the nurses on the floor, they have a lot of challenges with nurse-patient ratio. With the hospitals cutting back on expenditures, nurse's salary is one of the highest expenditures that a hospital has, and that's usually what they'll cut. And then the nurses have a high nurse-patient ratio, which is challenging for them to give optimal care. And not patients, but patients. compassion, empathy. Go for it. The best thing I ever did. I could never see me doing anything else but nursing. I just think that any woman who's looking to become a nurse should work in the field before they do it, because it's a lot of time and energy invested in to learning to be a nurse, and you would not like to have a nurse that goes through it just because she started the program and not happy at doing it, because it's a very challenging. It's the hardest job I've ever had, and it's the most challenging job I ever had. But on the same token, the most rewarding, because it was for me. If it's not for you, you're not going to be happy. And if the nurse ain't happy, the patient isn't happy.